All of your arguments are, nothing will get done without government. I can refute it easily by saying government is just people, and people will always find a way to do something with or without people. Pwned, bitch. So this particular talking point ignores one critical aspect of the consequences of people trying to work together. Let's say you live in a territory. That territory has absolutely no government protecting it. And let's say that you are one of a number of people who are routinely attacked by a band of marauders. After all, this is a completely stateless society. Property rights cannot and will not be backed up by any sort of law or policing because there is no state and the land exists as some form of anarchy. So these marauders strike, take your stuff and perhaps kill a member of your family. You've lost out. Now let's say that something similar has happened many times within your, let's call it a neighbourhood. As a consequence, you decide enough is enough and you want to do something about it. You can't do it yourself because, as previous experience has shown, alone you are in no position to do anything about it. Marauders will easily defeat you. So you team up with other neighbours to form a defensive force against any marauders. In doing so, you have also made the decision that in order to keep your defensive force running, you need to keep it well equipped and well funded, and therefore anyone who is in need of protection will have to pay into it. Otherwise you'll run into the free rider problem. That problem that Libby's keep ignoring or hand-waving away. What you also decide to do is to formally, among your entire group, recognise each other's right to hold their own property. That's it. Right there you've formed a de facto government. You might not like that fact, but you've done it. Without that de facto government, your property is not your property once it's been taken because no one else is going to help you keep it or get it back. Further, as I will need to point out in a separate talking point video, property rights are not simply a case of you patrolling the border of your property with a gun slung over your shoulder and a pickaxe in your hand to show that you work the land, because anyone can come along with a bigger gun and take it from you. Property rights are recognised by the government of the territory that you live in, and they dispense title deeds as well as the mechanism by which they can enforce your property rights against others. Without a formal arrangement codified in law, and most importantly, backed up by that nasty, horrible, evil threat of force against transgressors, your property can easily be taken by someone who has bigger guns than you have. This is what Randroids and ANCAPs aren't seeing or refusing to acknowledge, or they simply hand-wave away with excuses for why governments can't be trusted to run such a system. But somehow, a profit-making private firm whose sole motive is to make money can be trusted in place of a government who is supposed to report to its citizens. Now I can see a talking point coming up about how governments don't report to their citizens and don't represent the majority of their voters. This will be addressed in the future, but here's a pro tip in the meantime. Do not cite a totalitarian regime like North Korea as an example. I already oppose totalitarian states. Thank you. You can't use Lord of the Flies as an example of what libertarianism will look like. Jack represents the state. Oh no. Sorry. Lord of the Flies is entirely about a bunch of kids stranded on an island. All of these kids come from a state. They have been left to fend for themselves, and in the end they have to find ways of trying to survive by working together. No one individual in such a situation can represent an entire population of people just because you have decided that you don't like what they are doing in the book, or even in the film. Claiming that Jack represents the evil state just because he uses violence and orders his child subjects around doesn't accomplish that point. There is no police force on the island. There is no government on the island, and there are absolutely no property rights on the island. The most you can compare Jack to is that of a warlord with a tribe who will do absolutely anything to keep what little power he has as a result of being the warlord. Jack does not represent a state, merely a feudal tribe at best. All I hear from your videos is a rambling, incoherent rant. Really? You mean this?
There's two, if you spent any time at all studying this, you know right off the bat that these things. So the fact that he's made these two errors shows to me that he has this much understanding of what objectivism even means. This is probably the millionth, literally probably about the 12th or more times I've seen somebody attack objectivism, who in their attack shows that they really don't have any clue at all what they're talking about.
Or this. I think maybe this is the kind of incoherent rambling that the commenter who made this accusation meant. In any case, dismissing the videos as a rambling, incoherent rant when compared to the actual rambling and incoherent rants of others, such as Green Ghost 2008, is a little bit rich coming from them. Not wanting to be robbed by the evil state does not equate to wanting people to starve. No, but it can equate to apathy on the situation. Frankly, many libertarians, randroids and other ANCAPs have made several suggestive comments that clearly point to their lack of empathy when it comes down to people who are down on their luck. They say that if you can't support yourself for any reason, you're shit out of luck. It's an attitude that essentially says, fuck 'em. Charity organisations taking over the function of government departments who have access to and the power to use more funding and resources than any charity can possibly ever hope to achieve simply through voluntary funding will not be able to provide the services that those people who need them are going to need from them. Inevitably, as a consequence, many people will lose out. Government is not a bottomless pit of money, and I recognise this, but they can obtain far more through taxation and wealth distribution than any charity will be able to obtain through voluntary funding. Because, and let's face it, if everyone was willing to donate to charity what they have to pay in taxes now, then there would never have been a need for taxation in the first place. I argue for ultimate freedom, and that's far better than any use of force or violence. Often the kind of people who scream force or violence at you, aside from using the same appeal to emotion that I pointed out in previous Frivolous series, are also behaving like hypocrites. In the modern world, almost every industrialized country operates on some form of republic or democratic government within a mostly capitalistic society and have social safeguards for their citizens. These kinds of protections are what the vast majority of the people want. Those people who argue that democracy is mob rule do so because they are not getting what they want, and it's as simple as that no matter what they try to tell you. They voted for a free market capitalistic society where they never have to pay taxes, where they can live in a society where private businesses can do whatever they want, and where the only time laws are enforced is through a civil redress system of some form, whereby the only time someone holds somebody else accountable for anything, be it criminal or civil, is when a party who thinks they are wronged applies to have that wrong corrected. They did not get this society through the voting system because most people realize it's never going to protect them. As a consequence of the ANCAPs not getting their way because the vast majority did not want them to get their way, their solution is to throw a tantrum, crying like children about how unfair it is to them and having the arrogance to tell those people who do not agree with them what it is they really believe, and then throw around meaningless terminology like violence, theft and coercion. And they do this with the consequence of rendering those words meaningless when applied to actual circumstances of violence, theft and coercion that go on every single day in totalitarian regimes like North Korea, all the while advocating for the implementation of a system where the real use of force or violence from private enterprise can be used against anyone who does not have the money to either sue them in a civil court for such behaviours or to equip their own army to defend themselves. Now, there is one solution for these people. Somalia really doesn't have a government. You can go over there and enjoy their almost free market capitalistic society. I mean, after all, even though people are starving all over the place as a result of the environment they live in, coupled with a lack of technology and a lack of a supporting social infrastructure, they at least have the option of cheap cell phone coverage thanks to the free market, so that they can call anyone they like and tell them how wonderful it is that thanks to the free market they can talk on the phone whilst they are starving to death. To go back to the previous talking point, not wanting people to starve to death does not equate to wanting state-sanctioned violence, as opposed to enforcement of laws that everyone should be made aware of, or unfettered theft of people's property, as opposed to the legal, fair and mandated taxation of a percentage of a person's income, which everyone can afford if they are earning a living, and which applies to everyone in the system, including the President of the United States, the Premier of Canada, the Prime Minister of the United Kingdom, and every leader of any fairly elected, democratically run country in the first world industrialized nations on Earth. However, not wanting the evil, mean, unfair, totalitarian state to rob you might not mean you want people to starve, but it sure as hell does mean that you care more about keeping the money that you would pay in taxes to yourself than you do about making sure everyone gets a fair shot at life if they fall on hard times. Value-added tax pays for your healthcare, no wonder it's so expensive. The commenter who made this assertion didn't bother to provide any evidence that this was the case. Now at this point I would like to say that even Mr. Killian wouldn't be stupid enough to make this sort of mistake, but given that he used an arrest of 4 women going topless in protest at the Olympics as supposed evidence that the UK is more like a totalitarian state and less like a free country, I wouldn't put anything past him anymore. However, he did not make this suggestion. The commenter who made this suggestion neglected to realise one very important fact. I live in the UK and have done so all my life. Let's say you have two people having a discussion about the UK's healthcare system. One of them lives in the UK, the other one lives in the USA. Which one of them is more likely to know the most about it? The person who lives in the UK and utilises the NHS at times of need? Or the armchair quarterback who sits over there on their overweight fat ass bitching about how the NHS is a broken system that needs to be ripped out and replaced with a free market system instead, and how value-added taxes on goods and services is used to pay for it? Fucking idiots. The cost of the National Health Service is actually paid for from the Treasury's intake of national insurance contributions, which are threshold related in the same way as a given individual's income taxes. Value-added tax is sales tax and goes to the Treasury to be redistributed by central government for various projects. Council tax, paid by people on the given banding of the property they live in, goes to local government to take care of local infrastructure maintenance on publicly owned services. National insurance contributions are split between the state pension, contributions-based supplementary benefits, and the upkeep of the National Health Service itself. Now, this also doesn't address why it is that the UK doesn't pay anywhere near as much for health services per person as the USA does, but we don't have comparatively bad healthcare as a consequence. Why do people come to the USA to get specialist healthcare treatment? I have to ask you. No, you have to ask them. I can tell you it's not down to them not being able to afford to get the healthcare treatment in their own country though. And notice those that do go to the USA from overseas in order to get specialist treatment do so with the backing of rather large amounts of money, and often as a supplement to the healthcare they've received at home. However, this particular talking point was made in response to my point about people being denied treatment because they could not afford to pay for it, which means that the commenter was not actually addressing my fucking point. It doesn't matter how good the healthcare at the point of use is in the private system if you cannot afford to get treatment. Well, if you can't afford to get treatment, go to a charity to get some, or go to one of those free clinics. This is one I see around a great deal. If you can't afford to get private treatment at the top flight hospital somewhere, pay less and get less quality treatment. And if you can't afford that, apply to a charity to get a payment, or better still, just go to a free clinic. The problem is that free clinics, being voluntarily run, funded by donations, and utilising doctors and nurses who volunteer their services to help those poorest, are as a consequence chronically understaffed, under-equipped, and the little equipment they do have is likely to be severely out of date and in need of a major overhaul. Further, those staff who do work there are less likely to be qualified to the same level of expertise as paid doctors in private hospitals, unlike in a properly managed universal healthcare system where doctors are still paid well for their work but where everyone gets the required standard of care that they have a right to expect. Free clinics cannot match the quality of care of a publicly run system like the NHS, much less can they compete with private healthcare. There also appears to exist a variance in the quality of care in the US, with some situations having a certain type of restriction in place for those covered by certain insurance companies. At least one health insurance company I've heard of, that being Kaiser, demands that all treatment be taken at their hospitals, and from what I've been told by people who have had Kaiser in the past, this includes emergency ambulance pickups and visits to the ER. If you are not getting sufficient standard of care at a free clinic as you would expect as a member of a publicly funded or government-run scheme, then that's not good enough. Free clinics are well below the standards of the NHS, which doesn't operate as a charity or as a private business. The UK is fairly unique in this respect compared to other single-payer and universal healthcare systems in the industrialised world, in that the government manages payments for the services through taxation, in this case national insurance contributions as mentioned earlier, but also by owning and operating all of the hospitals in the country that are not privately owned. And yes, there does exist a private medical system in the UK. It exists as a supplement, as opposed to a replacement. Any treatment not available on private medical insurance, for example because of pre-existing conditions, will be picked up by NHS treatment instead. Nothing like this exists in the USA. The World Health Organization is talking out of its fucking ass. Their report was published in 2000 and was stopped because of some controversy. You're an idiot. So the commenter who made this comment, apparently quite seriously, suggested that infant mortality rates, and how American policy was to count every infant mortality including miscarriage apparently, was somehow evidence that the American healthcare ranking in the world should have been number 1 as opposed to number 37. Okay. There are some falsehoods I would like to address. The World Health Organization cited their reasoning for the last report being in 2000 as being down to the complexity of the task. Now this is understandable given that trying to compare every country's healthcare system is a monumental task, and they probably would be better off reallocating those resources elsewhere. Now I'm sure I'll get some tinfoil hats come out of the woodwork and go on about how it's the official story, blah 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 blah. I'm not really interested. It's the same sort of nonsense I see from the Illuminati conspiracist morons. Two of the critics of the World Health Organization's report are PhD doctors working in the field of medicine, who argue for US healthcare system on the basis of the quality of the hospitals and the treatments themselves. I have no objection to that, other than to point out that just because private healthcare can, and often does, provide a Rolls-Royce service to patients, whereas a public system is more focused on treatment and discharge, doesn't mean that public healthcare systems of other countries are not providing the required standard of healthcare that people need and have a right to. And again, private treatment might well be far superior to public treatment in terms of the bells and whistles, like a private room, greatly reduced waiting lists, especially in private healthcare in the UK, where their waiting lists for private treatment are virtually non-existent, and elective treatments that the NHS simply doesn't offer. But that won't amount to a hill of beans if the private treatment is the only option and people cannot afford to pay for it out of their own pocket. This is why practically every first world country has set up a single payer or universal healthcare scheme in the first place. Now the other critics of the World Health Organization's report were Glenn Whitman, a libertarian activist, and John Stossel, an advocate of free market healthcare and another libertarian who works for Fox News. There's no conflict of interest, is there? In fact, one of John Stossel's arguments was that if you don't account for homicides and car accidents in the country, then the USA has one of the highest life expectancies in the world. Do you care to say that we shouldn't account for homicides and car accidents in every other country as well, Mr. Stossel? Or would that upset your argument too much? You want to argue how bad the US healthcare system is? Only 15% of people aren't covered by medical insurance. Apparently the commenter who made this statement was quite serious once again. Let's say you have 330 million people in the United States of America. 15% of those are not covered at all. That's 49.5 million people without any sort of health coverage at all. And no, they're not all illegal immigrants, you fucking racist prick. This does not even take into account all of the people who have health insurance of a substandard utility. You know, those who cannot afford to get, or are not with an employer who can afford to pay for, an expensive plan that covers you for everything in the same way that the NHS covers you for in the UK. The vast majority of people can't afford a coverage plan that covers you for all of your medical costs at the point of entry, doesn't expect to pay you a deductible, and doesn't exclude you on the basis of any conditions you may or may not already have. Honestly, I'm not sure any insurance company even has a policy like that. So they are going to be left with a situation in which they might have to foot the entire bill themselves, where they might find that their medical treatment isn't covered, or where as a consequence they might go into massive debt, or they'll find their procedure will be cancelled and they'll have to go untreated. Not to mention this nasty extortionate habit that insurance companies have of penalising you for having the fucking audacity to use what you've paid for. It is illegal to refuse treatment in the USA. Sorry. No, it isn't. Not in all cases. The commenter who made this particular suggestion has probably forgotten to look at the news recently, where there are cases where hospitals have refused treatment either because of non-payment or because the patient's health coverage has been terminated. One such case was mentioned in my previous video on the subject. The only time it is illegal to refuse treatment on a patient is during a medical emergency. At that time, ambulances are obliged to get you to the hospital, and hospitals are obliged to get you in a stable condition so that your life is in no danger of being lost in the near future. But that's as far as the law goes. People can, and still are, refuse treatment if they cannot afford to pay in all other cases. Yay, private enterprise rocks! If you cannot get a good enough doctor on the free market, find another one! What if that doctor was consulted initially because of a suspicious skin complaint? What if that doctor just dismissed it as a mole that people get, because he hasn't been trained in how to spot malignant skin conditions? Going to someone else because he was wrong about you having a particularly virulent form of skin cancer isn't going to do you any fucking good, is it? By that time, the only thing someone might be able to do for you is to make you comfortable as you slowly die from the condition. This is one of my biggest arguments against free market capitalism getting involved in healthcare. People's cavalier attitude is that if you are in a position where your doctor is incompetent, just get rid of him and go somewhere else. Eventually everyone else will do the same thing and the doctor will be out of business. I'll cover this again shortly, but this isn't good enough. If you were talking about a shop owner selling magazines or cans of food, you might be reasonably expected to be taken seriously when you make an argument like this. But when it comes to medical care, where people's very lives are dependent upon an accurate, competent and fast diagnosis of any medical condition, such a cavalier dismissal of our concerns is callous and cold-hearted. Now, the same commenter who made this suggestion then went on about how it's all competition. No, life is not a fucking game. I don't want to have sharks competing for my business when it comes to my very health and life. Fuck off. Incompetent charlatans won't be doing business for very long because they'll be shunned out of the market. This is another of the sillier arguments. Look at Fox News. They have a news show which tells more lies and spreads more propaganda than The Onion. If this commenter were to be believed, Fox News would now be off the air thanks to the savvy and shrewd nature of the viewership and the removal of advertising revenues because their advertisers don't like being lied to. Unfortunately, this isn't Libertopia. This is the real world, where people can and do lie, where other people often fall for it, where advertising companies and businesses often care more about their reputation than they do about ethics, to the point that if it doesn't affect them, they won't mention it, even if they clearly know there's something wrong with what their advertising outlet is doing. Public relations is now something of an art form. Anyone who has a decent enough knowledge of PR can easily counter any bad reputation garnered through incompetence or malice with a PR campaign and a bit of propaganda. It's not that difficult for them, given that the majority of people are not wise to these tricks. And to anticipate another talking point I can see coming already? Well, if they're that stupid, we'd be better off without them diluting the gene pool, right? Yeah, and who the fuck are you to decide who gets to live and who gets to fucking die? These people might not even be stupid. They may simply need an education in critical thinking, something that Republicans and most libertarians who are in bed with them will never hear of, and a little more worldly experience. But that doesn't mean it should be sink or swim for these people. Now, I hate to do this because it can easily be construed as a naturalistic fallacy, but I often hear a lot of these people talk about how life has to compete in the environment for resources, and then that's how we should compete for our place in the environment of capitalism. Well, one of the most important factors in the evolution of most species on Earth is cooperation, and it doesn't have to be because of so-called rational self-interest, which ignores people's ability to be compassionate as well as ignores several people who are defective and do not have any sense of compassion, Shane DK and his buddies, and so ignores a severe flaw in the system. Humans shouldn't be competing against each other except in friendly competition where people's lives are not at stake. Capitalism is all well and good, but there has to be a limit. Keep it the fuck out of healthcare. Government-run systems limit your choices. Really? Japan has a government-funded healthcare system with entirely privately run hospitals. They're not limited on their choices, not to mention the fact that the UK has private healthcare as well as the NHS, and the NHS makes provision for personal preference when it comes to where you get treated, so long as your choice of hospital actually has the facilities you need for your treatment. They're fine with it. So, looks like that argument went out of the window and through the manhole and into the fucking sewer. But even if choice was apparently limited, as long as the standard and quality of care are maintained at a satisfactory level, such that everyone who needs treatment gets treatment and doesn't have to fucking bankrupt themselves or take on massive debt in the process, then I'm all for it. I would far rather be covered by a system where I have limited options for where I want to go, but I know I can get treatment that I need, than to have lots and lots and lots and lots and lots and lots of choices as to what kind of hospital treatment plan and other medical services I would like, none of which I can afford. Think about it. If I have cancer, I can either get treatment despite limited options, or I don't get any treatment because it's too fucking expensive for me. To sum up all of the talking points so far, my argument against the American health insurance model has nothing to do with the standard of care at the hospitals when you can actually afford to pay for treatment. And that's been my point all along. There isn't a single free market capitalist who wants the complete removal of all regulations. The commenter who made this statement to me apparently didn't bother to check with their colleagues on the internet to see if this view was shared all around. Those of you who have seen my previous Talking Points videos, and those of you who have had direct dealings with these people, will recognise this as incorrect. Many of them, in fact the overwhelming majority of them, do advocate the complete removal of all regulations. Some of them consider the idea of law itself as a concept to be illegitimate. Now this came from the same commenter who essentially used the "I don't see it happening, therefore it hasn't happened" defence that many fucking lunatics use when defending their particular political nonsense. Now that's all for now, but I'm sure I can come up with some more as and when people make some more ridiculous remarks to me in the future. I'll be doing another video on healthcare in the future, but I haven't put a deadline for it yet, so I don't know how long it will take to get it done. I also want to crack on with another video to do with homeopathy. For now, that's all. Thank you for listening.